to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we're learning about something new at Cape Fear Valley Health, and it is the Behavioral Health Community Paramedicine Program. Now, we have guests in the studio with us today that are going to talk to us about it, actually experts in the field. We have Cumberland County EMS Director. He is not new to Making Rounds Live, David Grovedahl. We also have with us today Community Paramedic Manager Linda Bailey, and we have with us today Community Paramedic Mental Health Social Worker, and it was great seeing her again, Elizabeth Marcus. Now, remember, folks, this broadcast is not a time for you to self-diagnose, especially with the topics that we're talking about today. If you find yourself or a loved one or a friend suffering from anything that we may discuss today, what I'm asking you to do is find yourself a health care professional. Now, ladies and gentlemen, we have a lot to discuss, so please join me in welcoming today's guest, Mr. Grovedahl, Ms. Bailey, and Ms. Marcus to Making Rounds Live. Welcome to the broadcast.
Thank you.
Now, first, Mr. Grovedahl, for those who do not know what the Behavioral Health Community Paramedicine Program is, like myself, could you explain what it is?
Absolutely. This is an offshoot of the 911 EMS system. So a lot of the 911 calls that we respond to are mental health, substance use. And so we are taking that subset. Paramedics are great at what they do. They are the jack of all trades. But mental health is just, it's an animal unto itself. And in our community, we have a great need for mental health. So we have paramedics and social workers and a peer support that are specially trained in dealing with all of the various aspects of mental health and substance use and working with all of our community partners. And so they really do a great job of bringing that team together. And team is the concept I think you'll hear a lot about today.
All right. What is the goal of the program?
So the goal of the program is to reduce admissions, more importantly, to reduce our violent encounters. In this community, we do see a fair number of violent encounters through the 911 system, and we see a lot of our mental health patients wind up in the emergency department. And the emergency department is just not equipped to deal with chronic mental health and substance use conditions. And so in our world, what we have seen, we had 2,300 mental health calls in 23. We're at almost 1,000 already in 24.
Wow.
And that's just mental health. And substance use, we're 1,300 overdose calls is what we saw. And we've already seen 1,000 of those in this year. So our numbers are very, very high in this community. And so we are proactively looking at opportunities to reduce those numbers, reduce the number of admits into our emergency department, and keep those people independent living.
This is a question that just came to mind. With those kind of numbers, automatically we call EMS when we're having heart issues or anything like that. Now you're adding mental health to the issue. Now you're adding substance abuse to the issue. This is stressing the EMS department out. It's got to be.
Our call volume is high. We are one of the largest 911 systems in the state of North Carolina. And so we're looking at all the different opportunities that we have to address our patient load. Some of them is to try to reduce the number of patients that we repetitively see. And some of them is to find better alternatives than the emergency department. Emergency department has always been the safety net of the healthcare system. So what can we do to find alternatives before we get to that point? And so if we can address issues, like I said, proactively,
Yeah.
earlier, then we have better outcomes with our patients.
Okay.
And we have a healthier community. And at the end of the day, I think that's what everybody wants.
All right. Ms. Bailey, how does it work towards accomplishing, or how does the program work towards accomplishing its goals? What does it look like?
Well, it's a collaborative effort throughout the county. Once we started looking into things, we realized there was a lot of resources out there that no one knew about. So my team went out and started connecting the dots. And we're geared and looking at what the community needs, what the resources are, putting everyone together in a local place. So then we know what we have out there, what we need.
Mr. Grovedahl, when I was doing the prep for this program, I was like, this is new. So how long has this program been in existence?
So this program is just going into its second year. We had a full year of funding this year with a collaboration with the county and a great partnership as well with the city. We had about a 6 to 8 month proof of concept period before that. So we've completed 2 years, and so we're really looking in this year 3 to do some great things. We got some great things coming up.
Awesome. Ladies and gentlemen, Cumberland County EMS Director David Grovedahl. I apologize for that. Also, Community Paramedic Manager Miss Alinda Bailey. And we have in the studio, we'll hear from her in just a bit, Community Paramedic Mental Health Social Worker Elizabeth Marcus. These are the experts today on Making Rounds Live. Now, you can join the conversation if you would like to. What you can do is you can call the WIDU studio at 910-483-6111. Again, that's 910-483-6111. Miss Glinda, awesome lady, she will answer the phone and take your question if you don't want to go on the air. Now, if you do want to go on the air, then you have to be nice to Pastor Paul, because if you're not nice to Pastor Paul, your call won't go on the air. Another way that you can get the questions or the comments to us is by way of the live stream going on now on Facebook, on Cape Fear Valley's Facebook page. Lindsay's working hard in the comments section, so if you have any questions, you can leave the questions there. She will make sure that we get those questions answered for you today. And also, we have a YouTube channel. Did you know about that? Make sure you share that. Ladies and gentlemen, in the studio with us today, Cumberland County EMS Director David Grovedahl. We also have Community Paramedic Mental Health Social Worker Miss Elizabeth Marcus, and we have Community Paramedic Manager Miss Alinda Bailey in the studio today on Making Rounds Live. Now, Miss Bailey, was this modeled after other groups, or did someone design this specifically for our area?
Community paramedicine is new around the country, but our program was modeled somewhat with other counties based on what they're doing, and then we took it and, of course, made it our own by what our community needed and to meet the needs of our community.
Are you mostly meeting patients through events or as part of 911 calls?
We meet them through the 911 calls, we meet them through community events, and even if we're not on scene, say police is on scene or sheriff is on scene, they know how to contact us, or fire, they know how to contact us and ask if we will follow up with a patient.
What if it's not a 911 emergency? Is there a way to request these services?
Through not just an individual, no ma'am. We're not equipped to handle all of that. We get the referrals from, as I stated before, from the police, from the fire, from the 911 system. That keeps us pretty busy.
Okay.
And that most of the time does encompass quite a bit of the population.
Mr. Grovedahl, how many staff members are involved in this program?
So as Linda had said, this model is relatively new,
Yeah.
and the community paramedicine program is really a hybrid of the 911 system. And so typically when you call 911, you get an ambulance, you're going to get a paramedic and an EMT or two paramedics who have been trained in 911 emergency medicine. So the community paramedicine program takes a paramedic who is cross-trained in a lot of social work type issues, and so you get that hybridization. So we have 4 paramedics who are trained in the community paramedic model. They're certified nationally as community paramedics. Then we have our expert social worker, Elizabeth, who you'll hear from shortly,
Yeah.
who is a licensed clinical social worker, and that is so important because she brings a viewpoint that is completely opposite of the paramedics, and so that is a very harmonious relationship. And then we add a peer support, or what I call the been there, done that person. So somebody who can walk the walk and talk the talk. They have lived the experience. And so sometimes where we don't necessarily build that trust level, the peer support specialist can build that trust level because they understand people in crisis and what it's like to have been in crisis, and can offer a perspective that we don't have because we've never really been there. So our team is got 4 2-in-1, so 4 community medics, 2 social work opportunities, and a peer support.
Now, ladies and gentlemen, Cumberland County EMS Director David Grovedall, Community Paramedic Manager Linda Bailey, and Community Paramedic Mental Health Social Worker Elizabeth Marcus, our guest today on Making Rounds Live. Ms. Bailey, excuse me, need for these services. What is the need like for these particular services? I mean, I know you mentioned earlier that it is that you get the calls and whatnot, but what is the need like for these services in our area?
Well, we have a large population of unhoused, underserved, and those that are battling substance use. So my team started an outreach program every 3rd Thursday at the Impact Kingdom Church right down the street. And the last event that we held was in April. It was 34 vendors that represent ways for these people that are in need to seek services such as getting an ID, getting hygiene, getting a free haircut. You know, the simple things that we take for granted every day. They don't have that. They don't have the access. And they're also served a hot meal. The last one in April, we served 78 individuals.
78?
78.
Wow. What does a success story look like in this program?
Wow. We've had a few. Our first success story was a lady that was camping out by the hospital, and we were asked to step in and see what we could do. She had known to be somewhat violent. Come to find out, she was under-medicated. Once we worked with the physicians, we got her medicated. We got her put in a temporary housing place, got her an ID, found out she had substantial amount of money in the bank, but you know, if you're not aware of what's going on, you're not aware of what you have. She is currently living in a group home, doing very well. We've had another gentleman that was looking for resources, came out to the event, got a haircut. He's now, the last time I was out there, he was bragging, he works full-time, he's got an apartment, phenomenal, and I think the marketing did a little story on him, interviewed him. And we have also, to our credit, have helped over 16 people to get outpatient services. We have 3 to go into a 1-year program, and we have 1 that's in a 2-year program. So there's success story out there, and it's wonderful to watch them happen.
This is amazing. Mr. Grovedahl, let's talk follow-up before, I'm thinking about if we can squeeze this in before we go to the news at bottom of the hour. Let's talk follow-up. And if we don't have time, we can continue to talk about it when we come back. Does the program help connect patients to other services, or does it keep track of progress in any kind of way with the patient?
It does both of those things.
Okay.
And so partnership is the hallmark of the program, and it is truly the success of the program. We connect a lot of the agency resources that either don't know about each other, or the patients don't know how to reach out. And so we connect the patient with the appropriate resource, the appropriate agency in the community. Mm-hmm. The other half of that is that we do stay and follow up with those patients. And so we make sure that they're getting to their appointments, that they have those resources and follow-ups. And so it is very important that we stay in contact with those patients. Just the other day, I myself encountered a patient on a 911, low to find out she just needed to see a therapist. That was her request. She just didn't know how. So reaching out to our community paramedic program, we found a resource that was able to come to the house the same day. And then Elizabeth herself actually checked in with the patient several days later to find out that she was connected with the right resources that she was looking for, and all the pieces and parts are in play. We'll stay in contact with her in the background, but we'll let the other agencies play the lead role when it comes to the very specific detail items. But I think that really is the power of our program. We can go to the living room and talk to patients and connect them with all the pieces that they need, and make sure the pieces are talking to each other and aware of each other. Sometimes that's the root problem, is left hand doesn't know what the right hand is doing.
This is great. Ladies and gentlemen, we're in the middle of an amazing conversation, and it is about the what was it again? I want to make sure I get this right, the Behavioral Health Community Paramedicine Program. And this is new, and I'm amazed at what I'm hearing right now. And what we're going to do is we're going to continue this conversation when we return. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
Pastor Gregory L. Davis from the Second Missionary Baptist Church here in Fayetteville, North Carolina. You're listening to Wake Up.
100 deadliest days of summer runs from Memorial Day to Labor Day. According to AAA, nearly half of all teen driver fatalities happened during that time. The UN Human Rights Office said today that both Israel and Hamas actions could amount to war crimes. Youth crime has been on the rise throughout the last year within the city of Charlotte. During Monday night's city council meeting, members got to hear their feedback from stakeholders on ways they believe the city could see a drop in youth-related crimes. Some cities in the Southwest are handling another record heat wave. Phoenix is taking steps to fight all of this heat. UNC will be playing in the opening game of the 2024 College World Series Friday as they take on Virginia in a battle between two ACC foes. Mike Rayleigh, NCN News.
I'm Jamie Manicelli, WIDU Radio News. The victim of the shooting that happened in the 800 block of Danish Drive has been identified as 7-year-old Zion Gibbs. He was a student at Benjamin Martin Elementary School. On June 10th, Zion succumbed to his injuries at UNC Chapel Hill Hospital. It is an active investigation. If you know anything about that incident, you are asked to contact Detective C. Cruz at 910-751-1046. Late in the evening on Saturday, June 8th, the major crimes detectives with the Cumberland County Sheriff's Office arrested and charged 22-year-old Suvid James Kakar of Apex, North Carolina, with felonious restraint. He was processed at the Cumberland County Detention Center and given a $250,000 secure bond. His first appearance was yesterday at 2:30 p.m. at the Cumberland County Detention Center. From WIDU Radio, I'm Jamie Manicelli.
We started off the work week yesterday with comfortable temperatures. I think that trend will continue again today, and then tomorrow the temperatures begin to take off. Still feeling quite good with pleasant humidity. It's partly cloudy this afternoon with a high in the mid to upper 80s. Mostly clear tonight. The lows fall into the low to mid 60s. Tomorrow is partly cloudy, mid to upper 80s, but it's more humid, so it will likely feel hotter. Partly cloudy and hotter on Thursday. Highs will be in the 90s, perhaps mid 90s in some spots Friday. I'm Mike Mays in the North Carolina News Network Weather Center.
Catch the vision. Join the team. My name is Jerry Swinney, a pastor of New Bethel Pentecostal Holiness Church, and I am indeed proud and thankful for the opportunity to encourage you to be a part of this great and wonderful work of WIDU. I pray that you will understand that we're in this thing together. We must support one another. Catch the vision. Join the team.
Hi, I'm a volunteer for Donald Trump.
Yeah, what do you want?
Your vote. Come on, Trump's our guy. He says he's the best guy ever for Black America. Better than Barack Obama.
Better than Obama? Trump's the guy who told America Obama was born in Africa. Never respected him enough to even accept him as president. All his white supremacist friends loved that one.
Man, that is old news.
Old news? Here's what's not old news. Trump is telling us right now he wants to be a dictator. Says he'll rip up the Constitution. Says there'll be a bloodbath if he loses again like last time.
Yeah, I wish you hadn't heard that.
Trump calls all those white folks who attacked the Capitol on January 6th heroes and patriots. He wants to pardon them. What do you think he'd be saying if it had been black folks who attacked the Capitol?
I don't know.
Yes, you do. He'd call them criminals and thugs, say they should be in jail, and throw away the key.
Yeah.
Get out of here, man. I'm sticking with Biden.
Me too.
I'm Joe Biden, candidate for president, and I approve this message.
Paid for by Biden for president.
Are you hurting from back or neck pains? Struggling with weight issues, especially during the pandemic? Don't feel alone. Many of us experience these same challenges. Grace Creek Chiropractic and Wellness Center, Dr. Joy Smith-Jones is helping many people with much-needed relief care. Spinal correction utilizing gentle chiropractic techniques, teaching and coaching corrective exercises, lifestyle advice, nutritional counseling, spinal and postural screenings, and dry needling and cupping are some of many treatment options Dr. Joy offers at Grace Creek Chiropractic and Wellness Center. Conveniently located at 5106 Highway 87 east of Fayetteville, Grace Creek Chiropractic and Wellness Center is easy to find. Experience the positive and uplifting environment with Dr. Joy and her staff committed to help you feel better and enjoy life. Reach out to Dr. Joy Smith-Jones, Grace Creek Chiropractic and Wellness Center for the relief care you deserve today. Call 910-703-3386.
God bless you. This is Apostle J.V. Porter, the senior pastor of the Christ Cathedral, 619 Cedar Creek Road here in the city of Fayetteville, inviting you to come and worship with us on this week. That's right, this week, 9:30, our Sunday morning worship, and on Wednesday, 12 noon, our Wednesday worship, and we are live and we're in person as well as viral. Come and be with us, where the Lord will bless your soul. 619 Cedar Creek Road here in the city of Fayetteville.
Greetings. I am Apostle Georgia Walker, overseer of New Hope Gospel Ministries Incorporated, located at 1059 Southern Avenue, directly across the street from Massey Hill High School. Our services are first Saturday of the month, intercessory prayer, Sunday morning worship at 11 o'clock a.m., Wednesday night WIM, Word Empowerment and More at 7 o'clock p.m., and Joy Night services every fourth Friday at 7:30. Come out and join us in our services. We would be glad to have you.
My name is Dexter Russell Sr., pastor of the North Ramsey Street Church of God, and you're listening to Wake Up.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Now, before we continue with our conversation about the behavioral health paramedicine program, I do want to tell everyone about some support groups that are available at Cape Fear Valley Health that you need to be aware of. First, don't forget about the Alzheimer's Caregiver Support Group. That meets, actually they have two. One meets the third Tuesday of each month, and that is from 2 until 3 p.m. at the Medical Arts Center, which is downtown on Robinson Street, Suite 106. And the other one meets the first Wednesday of each month from 2 until 3 p.m. at Harmony of Hope Mills. That's located over on Rockfish Road. And if you want more information about either one of those support groups, what you can do is call 910-615-1781. Again, that's 910-615-1781. Now, ladies and gentlemen, we are in the middle of an amazing conversation about a new program that is going on, or that Cape Fear Valley has to help the community. It is the Behavioral Health Community Paramedicine Program, and I have been amazed at the information that's been coming out about this program, what they're doing for the community, how it's benefiting the community. Been blown away by it all. But I know some of you are just joining us, so the question may be, we came in on the tail end of this, how do we get referred, or how do we get access to this program? So Ms. Bailey or Mr. Grovedahl, whichever one of you want to take the question, how would someone get referred to the program?
I would say come out to our outreach program that we have every third Thursday at the Kingdom Impact Global Ministry on Murchison Road.
Mm-hmm.
And there are all kinds of vendors out there. We register you, we follow up. You can specifically speak. The medics are out there. The Elizabeth is out there. Our peer support specialist is out there. And we have quite a huge turnout of many vendors with simple things. If this is where to meet us at.
All right. Let's talk about some of the specifics when you're dealing with a patient who needs substance abuse treatment. What can you provide?
We assist in getting them the specific help that they need, whether it's inpatient, outpatient, long-term, short-term. It's up to them. And at the time, if they decide, well, they're not ready for the treatment, okay, we continue to call back. Hey, how's things going? Would you like to reconsider? So we don't let them just drop through the cracks. And they always know that we're only a phone call away.
Ladies and gentlemen, I'm getting ready to introduce and bring on a lady that has been sitting so patiently throughout this whole interview. Her name is Ms. Marcus, and she is a social worker with the Paramedicine Program. Now, Ms. Marcus, as a social worker, where exactly do you fit into all of this?
Sure. So one of the things that's really nice about social work is we get to look at a broader picture of individuals. We're looking at those social, emotional, environmental factors that kind of go into that overall well-being. And whereas traditional paramedicine, you're kind of looking at the acute crisis right now, what's happening right now. And so this program gets to blend those things together beautifully to really get a whole picture of a person. So we can look at the acute crisis. We can look at what is this 911 call, what's happening now, but also what factors are contributing to the need to utilize emergency services, and how do we put some stop gaps in, help this person from falling through the cracks, prevent some of these barriers from happening in order to make this person, more whole for now, but also in the long term following this event. I find that this merge is really beautiful because mental health is such a huge factor for health. Anybody can be affected. Anybody can have a mental health crisis. There truly is no socioeconomic background. There's no race. There's no gender. It can affect anyone at any time. So having these things work together within our 911 system, I think really does help impact the well-being of our community as a whole.
Now, you mentioned something, mental health, it doesn't discriminate, as you might as well say. It affects the rich, the poor, the underserved. So one thing that I really want our listeners and our viewers to understand is that when you're talking about going into the community and going into these particular areas, you're not just talking about going into the underserved areas. You're talking about going into the prestigious areas of the community as well, correct?
Oh, absolutely. When you map it out, there's no specific location in the city of Fayetteville or in Cumberland County that is seeing these challenges, that is having a mental health crisis, that is suffering from substance use. It's everywhere. It's within our community as a whole. And again, there are no bounds. There are no specific labels that we can put on people to say that this is where it's at. It's throughout the community, excuse me. And that is a big thing to hit on.
Ladies and gentlemen, Cumberland County EMS Director, Mr. David Grovedahl. We also have with us today Community Paramedic Manager, Miss Alinda Bailey, and Community Paramedic Mental Health Social Worker, Miss Elizabeth Marcus. These are our experts today on Making Rounds Live as we discuss a fairly new program that Cape Fear Valley Health has implemented, the Behavioral Health Community Paramedicine Program. And by what I'm hearing right now, it is an amazing program, and it is a program that this community has needed for a long time. Now, Ms. Marcus, are you answering calls with other paramedics?
So the short answer is yes. But of course, there's a much longer answer to that. Absolutely. We'll go out with our team. They can go out and respond to a 911 call. I have been called by crews currently on scene to either come out to the call or to just advise from kind of behind the scenes, hey, this is what we could plug in, this is what we can do. But then also we're doing that follow-up from those initial 911 encounters. We're looking at who is coming through the 911 system with mental health challenges, with substance use challenges, with suicidal ideation. We're kind of looking at all of that and then following up. How can we prevent this from happening again? What can we put in place? Who can we connect them to in order to prevent this crisis from reoccurring? Because that's always the goal. If you don't change anything after the crisis, it's probably going to happen again. So how can we best serve our community by making sure that we're getting those resources to the individuals who need them?
What about self-harm or suicide-related calls?
Sure. So this is actually a report that we look at that's kind of individual from our regular EMS referrals. And when I say that, I mean that our EMS crews can refer directly to us through our system. They can let us know this is a patient that we'd like you to follow up with. The suicide-related calls is a completely separate report. They do overlap, of course, because our crews are amazing and they will refer those to us. But it's also a separate report so that we're making sure people aren't falling through the cracks when they're identified as having suicidal ideation, any kind of thought of self-harm, whether it's passive, impassive, they say directly, I want to harm myself, or they say a comment like, I just don't want to wake up tomorrow. I can't do it anymore. This is all hopeless. And our crews are great at picking up on those things and letting us know this is what's happening. As soon as it gets marked in our system as that person is suffering from suicidal ideations, it goes on a report that we're running separately. And then I'm looking at that report. I'm trying to follow up with each individual, trying to do some of those risk and safety plans, whether it's just meeting with the individual, making sure that they are safe for the now, making sure that there's things in place. If it's, hey, do you know who to call? Do you have that phone number written down in case your phone dies and you need access to somebody right away? Do you have your medication stored in a safe place? Do you have things that you do that are typical distractions? Has this happened to you before? Is it something that you can work on? Did you have a coping skill that worked in the past? Really trying to meet the individual needs of a person, because of course we're talking about an individual issue. What works for someone isn't going to work for everybody else. So it really is person-centered, working with them, finding what works for them, and then how do we make sure, again, that they're safe for now while we're getting them connected to resources in the long run.
What if the patients are children or teens?
So that's a whole other kind of spectrum that we also look at, we work with some amazing community partners who specialize in from ages to 3 to 21. And they're able to really take the reins on a lot of those and do some of that case management that we're doing kind of on our team, and they can handle it. So when we identify that it's a crisis in that age group, one of the things, of course, that we always have to do is get that parental consent if they're under 18. But once we can get that family on board, we can kind of wrap them with a partner who's going to do more of the in-home things or provide those services that are specific to that family, whether it's kind of help with family therapy, working together, any kind of crisis response. As Chief said a little bit earlier, we actually had one of our youth providers go out to a home where a mother was in crisis. And because it was a crisis that was affecting the family system as a whole, this mobile response team came directly to them to help facilitate, getting the resources out into their hands immediately.
Wow.
Yeah.
Wow. Ladies and gentlemen, we are having a very interesting conversation. I'm just drawn into it right now. Cumberland County EMS Director David Grovedahl. We also have Community Paramedic Manager Linda Bailey and Community Paramedic Mental Health Social Worker, who you've been hearing, Miss Elizabeth Marcus. Our experts, our guests today on Making Rounds Live, as they discuss the health system's behavioral health community paramedicine program. It's a mouthful, but I tell you what, it's needed for this community. Now, Mr. Grovedahl, how do you see this program moving or growing? Because I see you're so excited about it. How do you see this program moving or growing in the future?
We have some really great programs that we're getting ready to start. We're making sure the infrastructure pieces are ready. We notice in our community there are certain trends, and so there are some tailored programs that we can work on. Children, as you mentioned, are a big part of the community, and mental health in children and substance use in children are a real thing. And so we see it every day, and so really tailoring programs specific to our adolescent community is really important. Tailoring some programs where, with our mental health, to make sure that their medication is regulated. We've got some great opportunities coming up in the near future for that. And obviously expansion to be able to handle the call volume that we have, so that we don't necessarily always have to send an ambulance out to every single call or send law enforcement out to every single call. Because there are those calls where law enforcement is important, but there are those calls that law enforcement is actually not helpful being there, just because of the connotation of a gun and a badge being present. And so how do we best serve our community by sending the right resource the first time? And so we're really, really looking at that, and where do we get those patients to? If it's not the emergency department, where can we send them to? And technology has been advancing thanks to the COVID. We don't say a lot of positive things about COVID, but one of the things we can say that's positive is telemedicine, telehealth.
Yes.
Basically, the medical Skype is what we call it.
Medical
And
Skype,
so
I like that.
having those programs where we go to the living room. That's what we do. We go to where the patient is. We can't always take a physician with us. That's not really reasonable. But we can go to a house and connect them with a physician via the technology. And so we're working on those pieces. They're coming hopefully in the next 6 months. Maybe when we come back, we can talk about those success programs as well. But a lot of really great, exciting programs coming on board.
Now, we've been talking about all of the great things that the paramedicine program is providing, or the behavioral health paramedicine program is providing. Got to ask you about challenges. Are there any challenges that you're facing with this program?
Oh, absolutely. There's always challenges to the program. There's the type of patients that we just can't seem to find the right puzzle pieces that connect them, and the right resources. The resources themselves are full. Mental health in North Carolina, there's just not enough of it. And so we need more of those resources. And here at Cape Fear, we've built a pediatric mental health hospital. We've built an adult mental health hospital, and they're full. We put psychiatrists in the emergency department, and they're seeing lots of patients, and the emergency department is full of patients. We're looking at building another mental health hospital on the Harnett campuses.
Wow.
So there's growth in the entire mental health service line at Cape Fear. There's a lot of resources going in, but at this point, we're trying to play catch up with all of those things. And so how do we expand the program to better serve the community? How do we get out there and be known with the right people, and just being able to connect all the dots for all the patients. At the end of the day, at the heart of all of our team is we want to help everybody.
Yeah.
And that's hard because we don't have enough staff yet to do that for the community, but we're getting there. We're getting there.
One question that just came to mind: how did we get so far behind with mental health in the community? Because you were saying that you're playing catch up. Well, somewhere down the line, we had to get behind. So when did all of that happen?
I think mental health and substance use has always been there. I think the population has always been there, but it's been covered. It's been covered in the community, not intentionally, but it's been one of those things where we deal with the chronic medical conditions. We don't necessarily always catch the mental health. COVID was very detrimental to mental health. It was very detrimental to substance use, and so I think a lot of that is just has been the different things and challenges that as a society we've had to address. And when we went into that pandemic phase, it really kind of reared its ugly head. And as we've come out of the pandemic phase, we're seeing it and identifying. And as a culture, we have accepted it and said, this is an issue we have to address. And we've acknowledged it. And like many things, the first step is acknowledgement. And so we have put it in the forefront now. And I think we're getting there. I think we're getting there.
Ladies and gentlemen, we're having an awesome conversation right now about Cape Fear Valley Health's behavioral health community paramedicine program. Basically, all of these different entities are coming together in the community to help our mental health population, to help folks who are battling substance abuse, to help folks who have suicidal thoughts, for folks battling depression. All of that is what basically they're doing, and these are the experts that are here to talk about it today. Now, Ms. Bailey, if our listeners want to help this program, if in any kind of way, how would they go about doing that, or would they be able to do that?
To help the program, it's not directly but indirectly. Be supportive of the community. Get involved. Get your churches involved. If they have a service that they feel that would benefit some of the people that we serve, please reach out to us during the community event. We would love to see that to grow to where we have it in 2 places at one time. That's how we do it. And the main thing is join us at the mobile outreach, to contact us, and if they have something that they can give, whether it's time, a service, we can find a slot.
And what I'm really loving is that Kingdom Impact, they're taking a lead in churches that don't want to talk as we close out today's program.
Yeah, I definitely just want to mention, save the number 988. If you don't know what 988 is, it's the expanded suicide mental health crisis hotline. So it traditionally was the suicide hotline. They've expanded. They can handle mental health crisis. They can handle substance use. They work specifically with veterans. There's multiple languages that you can chat with. You can text it, you can chat on the computer, and you can call the number 988. But they've found that 80% of crises can be de-escalated over the phone. which is huge to know that it could simply just be a phone call away, someone just needing that instant connection right there from 988. So I want to make sure that everybody has that saved. You have it. They can also get connected with local community resources too. They can be that bridge, whereas, someone might not encounter us, but they're going to get the help they need regardless.
Okay. Ms. Bailey, Mr. Grovedahl, whichever one.
I would say that if you are listening and you are experiencing mental health or substance use issues, if you know somebody that is experiencing a crisis or is on the verge of a crisis, reach out. If it's through 911, if it's through contacting your physician, going to the emergency department, say something. Because there are resources in this community. There are great people doing great things in our law enforcement, our fire service, our EMS, and our hospital. Don't feel like you are somebody who can't access those resources or is not deserving of those resources. Everybody is deserving of our time and our love and our resources, and we want to help the community be the best it can.
Thank you for saying that. Ms. Bailey?
I would again just say, come out, join us. Come if you really want to see what we're about. Join us on every third Thursday, and you'll see the community in action.
And give the listeners that information one more time in case someone just tuning in.
So it's held every third Thursday at the Kingdom Impact Global Ministry, the church on Murchison Road.
All right. Well, ladies and gentlemen, please join me in thanking today's guest, Cumberland County EMS Director David Grovedahl. We also had Community Paramedic Manager Miss Alinda Bailey, and a lady who is very passionate about her work because I heard it while she was talking, Community Paramedic Mental Health Social Worker Miss Elizabeth Marcus. Thank you all for being on the broadcast today. I enjoyed this interview. Thank you so much.
Thank you for having us.
Thank you.
Now, ladies and gentlemen, let me try it again. Take two. Ladies and gentlemen, our next broadcast is Tuesday, June 25th, and we're going to continue our kidney health discussion with Dr. Moses Kumi. So make sure you join us for that. For our producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the hardworking team behind the scenes, I'm Omega Jones, continuing the work for Darvin Jones. Thanks for listening to Cape Fear Valley Health's Making Rounds Live.
My name is Dexter Russell Sr.,